Hey guys, welcome back to another episode of TDP. Long time, huh? Yes, ನಮ್ಮದು ಎಕ್ಸಾಮ್ ಇತ್ತು ಅಂತ ಇಷ್ಟು ದಿನ ಕಂಟೆಂಟ್ ಪ್ರೊಡಕ್ಷನ್ ಮಾಡೋಕ್ಕೆ ಆಗಿದ್ದಿಲ್ಲ. ಆ್ಯಂಡ್ ನೌ ವಿ ಪ್ರಾಮಿಸ್ ದಟ್ ವಿಲ್ ಬಿ ಪ್ರೊಡ್ಯೂಸಿಂಗ್ ಮೋರ್ ಆ್ಯಂಡ್ ಮೋರ್ ಕಂಟೆಂಟ್ ರೆಗ್ಯುಲರ್ಲಿ. ಸೊ ಯಾವುದೇ ಕಂಟೆಂಟ್ ಮಿಸ್ ಮಾಡ್ಕೊಳ್ದೇ ಇರೋದಕ್ಕಾಗಿ ಮೇಕ್ ಶ್ಯೂರ್ ಯು ಹಿಟ್ ದಟ್ ಲೈಕ್ ಬಟನ್ ಆ್ಯಂಡ್ ಕಾಮೆಂಟ್ ಮಾಡಿ ಅಂತ ಹೇಳ್ತಾ ಇವತ್ತಿನ ಈ ಎಪಿಸೋಡಲ್ಲಿ ನಮ್ಮ ಜೊತೆ ಡಾಕ್ಟರ್ ಆಶೀಶ್ ಸರ್ ಇದ್ದಾರೆ, ಒನ್ ಆಫ್ ದ ಬೆಸ್ಟ್ ಆರ್ಥೋಪೆಡಿಷಿಯನ್ಸ್ ಇನ್ ಚಿತ್ರದುರ್ಗ. And to tell something about him, he is one of the well-known orthopedic surgeons. This episode we are going to talk about his internship life and what we are supposed to do in internship and what we are not supposed to do. And ಕಲಿಯೋಕ್ಕೋಸ್ಕರ ನಾವು ಏನೇನು ಮಾಡ್ಬೋದು and all about FMG and post PG ಲೈಫ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತೀವಿ. ಸೊ ಸಿಟ್ ಬ್ಯಾಕ್, ರಿಲ್ಯಾಕ್ಸ್, ಕೊನೆ ತನಕ ಎಪಿಸೋಡ್ ನೋಡಿ ಅಂತ ಹೇಳ್ತಾ, ಹಾಯ್ ಹಲೋ ನಮಸ್ಕಾರ, ನಾನು ನಿಮ್ಮೆಲ್ಲರ ಪ್ರೀತಿ ಅರುಣ್ ಬಸವರಾಜ್ ಆ್ಯಂಡ್ ದಿಸ್ ಇಸ್ ದ ಡಾಕ್ಟರ್ಸ್ ಪಾಡ್ಕಾಸ್ಟ್. Dr. Ashish sir,
Yeah.
welcome to the show sir.
Thank you.
How are you feeling today sir?
I'm good. So how are you feeling?
I'm feeling great sir. In fact, I just passed my final year MBBS sir ರೀಸೆಂಟ್ ಆಗಿ ಆ್ಯಂಡ್ ಇವಾಗ ಡಾಕ್ಟರ್ ಆಗಿದ್ದೀನಿ. ತುಂಬ ಒಳ್ಳೆ ಫೀಲಿಂಗ್ ಅಂತಲೇ ಹೇಳ್ಬೋದು ಸರ್. ಆ್ಯಂಡ್ ಇವಾಗಿನೂ ಇಂಟರ್ನ್ಶಿಪ್ ಸ್ಟಾರ್ಟ್ ಆಗಿದ್ದೀನಿ ಆ್ಯಂಡ್ ಐಮ್ ಫೀಲಿಂಗ್ ವೆರಿ ಗ್ರೇಟ್ ಸರ್. ಲೈಕ್ ಆ ಇಂಟರ್ನ್ಶಿಪ್ ಡ್ಯೂಟಿಲಿ ಪೇಷಂಟ್ಸ್ ನೋಡಿದಾಗ ಅವ್ರನ್ನ ಮಾತಾಡ್ಸ್ಬೇಕಾರೆ ಇಟ್ಸ್ ಫೀಲ್ಸ್ ಸಮಥಿಂಗ್ ಸ್ಪೆಷಲ್ ಅಂತ ಸರ್. ಆ್ಯಂಡ್ ಇದೇ ರೀತಿಲಿ ನಾನು ಇವಾಗ ಇಂಟರ್ನ್ಶಿಪ್ ಎಂಟರ್ ಆಗಿರೋದ್ರಿಂದ ಐ ಆಮ್ ಪ್ಲಾನಿಂಗ್ ಅ ಲಾಟ್ ಆಫ್ ಥಿಂಗ್ಸ್ ಟು ಡೂ ಇನ್ ಮೈ ಇಂಟರ್ನ್ಶಿಪ್ ಸರ್. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಇವಾಗ ಐ ಪ್ಲೇ ಅ ಲಾಟ್ ಆಫ್ ಸ್ಪೋರ್ಟ್ಸ್ ಆ್ಯಂಡ್ ಐ ಆಮ್ ರಿಯಲಿ ಲುಕಿಂಗ್ ಫಾರ್ವರ್ಡ್ ಟು ಲರ್ನ್ ಮೋರ್ ಅಬೌಟ್ ಸ್ಪೋರ್ಟ್ಸ್. ಆ್ಯಂಡ್ ಈ ಪಾಡ್ಕಾಸ್ಟ್ ಮಾಡಬೇಕು, ಈ ಪಾಡ್ಕಾಸ್ಟ್ನ ಇನ್ನೂ ಚೆನ್ನಾಗಿ ಮಾಡಬೇಕು ಅಂತ ಐ ಆಮ್ ಪ್ಲಾನಿಂಗ್. ಆ್ಯಂಡ್ ಅದ್ರ ಜೊತೆ ಐ ಆಮ್ ಇವನ್ ಪ್ಲಾನಿಂಗ್ ಟು ಪ್ರಿಪೇರ್ ಫಾರ್ ಮೈ ನೀಟ್ PG ಎಕ್ಸಾಮ್ ಸರ್.
Okay.
So I'm planning all of these things and I really want to ask you, ನಾನು ಸರಿಯಾದ ದಾರಿಲಿ ಹೋಗ್ತಾ ಇದ್ದೀನಾ, whether it's right to do all those stuff ಅಂತ.
Yeah. So from my point, like congrats for your finishing of your MBBS right now. Okay, that's really good part. So starting off your internship, right? So you're in a fresh blood and you have enthusiasm to do many things. So when we started these all things, there were nothing to be asked. Okay, so we entered it. So I finished my MBBS in Mangalore, KSEGDE. Okay, and I took an what you call externship. I mean, like I shifted to my hometown, Davangere. Okay, so basically why I did that, I don't want to blame Kshema people for not giving, but still, yeah, I just wanted to work. Okay, so I shifted to a JJM, okay, which is attached to a hospital, okay, government hospital, CG. So there's a lot of work. Okay, so I was already, by the time of MBBS, okay, I was tilted towards surgery part. Okay, so idea was clear that I wanted to be a surgeon. Okay, so that part was clear to me. So the thing is, it depends on how you get inspired in your 4 years of MBBS and how much you are tilted and how much you are able to handle the things. Okay, there are many people like in your 4 years you will know that, like, can I be in the OT for long time? Okay, can I sit and manage the what you call emergencies? Okay, so for that part you need to have an adrenaline rush plus a calm mind. Okay, so basically you need to have that things in your brain which is clear. Yeah, many times you will not be clear until unless you finish your internship also. That's okay. Okay, that's really okay. There are many people who have changed after internship also. Okay, who wanted to be a surgeon. Okay, so basically they have choose completely a different aspect. Okay, so that's also okay.
Okay, coming back to your internship sir.
Yeah, so I choose JJM. Okay, so there was extensive work and there was always, see, one thing I'll tell you is, like, you have to work as an intern. Okay, and whatever the things which are not clear for you during your 4-year MBBS, it was maybe a theoretical part. Okay. Now you have to be a practical part on it. Okay. And we start asking the questions. And if you want to be a surgeon, from my point, start putting sutures. Okay. Dig the people who are there around. Ask the PGs, run around them. Okay. Okay. They may not give chances, but at least definitely will put a suture. Like at least in Basaveshwara, like we are giving the suture. Means at least those things at the end, okay, on the live patients also, okay. So yeah, definitely we would have trained you, then we would have given it to you, okay. Those things you should do it, okay. Until unless you go around and do things, nothing will happen. So same thing happened to me in JJM. I was an extern, okay. So I have to run around too many people, okay. There will be always JJM college guys who were my batchmates, so I have to get along with them, plead the PGs to get that things done, okay. I think I have done all the procedures. For that I'm lucky, okay. So I wanted to do it, so I did it. So same thing for you guys. If you want to do it, definitely you will do it, not just writing the case sheets and all those things. I'm telling. So it definitely will, you guys will do, okay. And that's what I wanted to tell you as an intern. That's the one thing I'll tell you, like whatever you want to do it, go into the department, okay. If you don't know anything, ask the PGs, ask the consultants, okay. Nobody will tell no during internship period, okay. They may scold you, what max, okay, nothing much, okay. That's the best part of being in internship, is that you don't have responsibility. Yeah, you are responsible for the patient, but not completely, because there are PGs, there are also consultants, okay.
Who are ready to take the responsibility.
Yeah, who can have the heavy load of responsibility. Under their guidance, you can do many things, okay. So yeah.
I just remember what Dr. Sharat sir told in the last episode, sir. He was talking about the same thing, sir. When he was an intern, when he was a PG, first year PG,
Yeah.
he left a blade inside a patient's chest, sir.
Yeah.
And he was saying that mistakes are meant to be made and people are there to correct you.
Yes.
So don't be afraid to make mistakes. And
Yes.
sir. So,
Yeah.
I guess. Sir, and coming back to your part of internship, sir, and how was it, and what were the mistakes you made, and you want us to not do it again?
Mistakes, yeah. One thing is like there was no right thing like you have to do this way. This is basically CG was it's a C. Okay, like C means like there are number of patients are there. They'll allow you to do it, but there is no right way to do it. Okay, so whenever you're doing any procedure on any patients or anything, okay, make sure you do it in a right way. That's the best thing, okay. So learn it in a right way. Maybe I have done many sutures, but my best sutures were coming only probably after second year of my PG, or I can say that, okay. So you can see the duration, okay. So putting the suture is not the best part, okay. Putting it beautifully, that matters a lot, okay. Scar is a scar for the patient, right? So that way I'm trying to tell you, like start putting the things, learn the things in a proper manner, okay. So when you are in doubt, maybe a small catheterization is a part, okay, but put it in a right way. Bring the consultant, sir, please stand here, I'll put the thing, okay. He may scold you, hey, what this Baba, like you are just an intern, sir, 2 minutes, just I'll put the thing. Nobody will scold you for that, okay. At least an SRs are there are many people are there, so nobody will scold you, okay, for that. So that way learning things in a right manner is important, okay, so that you will not falter it later, which makes you big mistakes, okay. So many a times I have seen with catheterization, urinary catheter, they have blown up the ureters, okay. That happens because you are not under the observation of someone, okay. So you have to be under observation of someone to do things, okay. Once you're confident, yes, definitely, okay. Putting a IV cannula is a left hand job, maybe at the end of your internship, but not at the starting of your internship. Yeah, that way you should be really careful. So that way take everything in a starting things. You may be in a Josh, in a blood thing, okay, like you are in a fresh blood, I want to do all the things, but pick it up from the consultants, pick it up from the third year PG, maybe he knows better things, okay. So that way, yes.
Okay, I don't want to point on anyone, but the truth is we don't get many chances here as a private college.
Yeah, I understand
I
that.
have been posted in the district hospital for like
Uh-huh.
last 1 month, I guess,
Yeah.
and I will be there for 2 more months.
Yeah.
And what the exposure I am getting over there, my
Yeah.
friends, I mean my batchmates are not getting here.
Yes.
That's the truth. That
Yeah,
has to be
that's-
spoken.
yes.
And if you were to put in my shoes, sir,
Uh-huh.
what is that one thing that you would do so that you will get the same amount of exposure that the government college students will get?
So, see, in a government college, it's like it's for everyone. Okay, so it's a completely charitered hospital. Okay, same thing you will not expect in any of the private colleges. Yeah, if that has to be there, then many things have to change. I mean, it has to become a charitable hospital. Okay, in order to increase the patient inflow and all those things. So once you have a patient, then only you can have that experience. Okay, one thing is that. One more thing is like you have to increase the number of specialties, you have to increase the good number of cases what you're doing. Okay, we are relatively less now. We might, like for example, we don't have all the specialties in surgery for us. For orthopedics, yeah, after we have improvised little bit, but still we don't do much of a spine. Okay, so in order that arena of doing all the specialties may bring many patients. Okay, so for private medical college there's always a challenges to things are there, but that's left to the management part. Yeah. So
Let's not go over there. Let's talk about our part.
So maybe our part is the only thing we have to give a good results and all that we are doing, but still, yeah, charitable part has to be increased. That's there.
If you were to be an intern in private college, how you used to manage the learning part?
So I was there as an intern in Makshema. Okay, so for a partial of 3 months. So what it was an organized manner. Okay, so for example, say in my orthopedics, I'll tell, I don't know other departments. So there are 6 to 7 interns are there. Okay, so divide amongst yourself. Okay, among what unit you want to go. Okay, so make sure one guy rotates in a OT. Okay, so one day you go to OT, next guy goes to OT, next third day he goes to. So in a manner you rotate in a OT. Okay, one guy go to wards. Okay, and one be in a OPD. Okay, I think you will see all the cases. Okay, and in last 1 month also, if you have observed our just a case sheets, I think there is all the variety of cases from osteomyelitis to dislocations to everything would have come and gone. Okay, but if you close your eyes and you just finish that, okay, my duty is done. Okay, then you will not see much of cases in an private setup. I mean private medical college, I'm telling. Because private medical college, we do have all the cases, but maybe I will get 2 or 3 dislocation, maybe 4 to 5 dislocation in a month. But unlike in a government medical college, in a week they'll get 4. Okay, so that way, if you not stay in the department for a long time, I will not say till 12 o'clock or something, but at least till 7 o'clock, make sure that you stay there. You see the cases and rotate in between the OTs. Every day we do 2 to 3 OTs or maybe 1. Okay. So when we do that, get inside the OT, see the diagnosis properly, what exactly it is. Okay. If you don't know, ask the consultant. Okay. Ask the PGs, third years. Okay. So I think you will see the varieties like that way. Okay. But don't lay around the things. Yeah. That's the important way.
Sir, I told you at the beginning that I'm even planning to prepare for my PG exams.
Yeah.
So there was always that confusion that whether I had to do my PG in India or in abroad. A lot of my friends have that dilemma in their head running around, sir.
Yeah.
What do you think, sir? Is it better in India or in abroad?
Yeah, you and I had my dilemma the same way. Okay, so that way, see, dilemma is always good. But it has to be sorted, right? So for sorting that, you need to know the people who have gone there. Okay, so make sure that like whenever you want to decide upon that, okay, you need to ask your seniors who has gone there in a recent past. Okay, I will tell with my experience like what my seniors have faced when they went to USMLE and also for a PLAB. Okay, US as a broad thing, you have to plan it in long term. Once you go there, you can't come back. I mean, like once you finish that, okay, you practice there. Okay, I will tell like I will come back to India and I will practice it. Post PG in US it's not possible. Okay, you have to stay there, you have to work there.
For how
Okay,
many years?
maybe
For the
long term for 15 to 20 years, 30 years. Okay, so that is there. Okay, I'll do my PG there and I'll come back.
That's not possible.
That's not possible basically, because whoever I have seen, they have never come back. Okay, they might have come back only at the fag end of their working years, maybe 61, 62. Okay, so that might the one part. Okay, in UK scenario is also same. Okay, I have worked with UK consultants when I was working in Bangalore. For few of them, they have literally slogged there for slog means they have worked the better part of around 20-25 years post internship. Okay, so that way you, whenever I see them going there, you have to plan only in the long term, and planning for US and UK also should be your depending upon subjects. Okay, surgical part is not usually available in the US scenario,
Why?
because like US scenario is completely different. I mean, like for being an orthopedician, you have to do first surgery, then you go for orthopedics.
It's a super specialty.
Yeah, it's a super specialty branch. Okay, for it's around 7 years of thing. Okay, so and also and there are hardly some 12 to 14 orthopedics PG that is available in whole of USA. Okay, it's like it's really difficult to match. Okay.
So the demand for orthopedicians will be much higher over there, I guess.
Yes, it will be there for neurosurgery, for like orthopedic surgery, for gastro. It's very high.
What if we complete our orthopedics in India and we get over there and settle there?
Yeah, you can do that, but you have to again start from the bottom rung. I mean, like even though you do any specialty in India, you have to go back there and you have to start again doing the same thing. I mean, like literally you have to slog from the pre-PG years. Okay, that is how in US scenario. But in UK scenario is little different. Post PG definitely you can do MRCS. Okay, FRCS. Member of Royal College of Surgeons. Okay, so there is a step 1, step 2. Okay, you can finish that, and you did not pass the PLAB also. You can go through OET routes. Okay, that is English tests are there. So post PG also you can plan to go to UK and practice there. Okay, so there is one way it is available in UK only.
Okay, how many years it might take after
Post
getting
PG.
PG year and get?
Okay, so post PG they say approximately around 2 to 3 years. Okay, 3 to 4 years, depending upon same. Like if you get a good consultant who you are able to pass your FRCS, there is all consultant, like he will be a boss, okay, under whom you will work for about 3 to 4 years, and when he is able to give a FRCS exam, okay, post that he will be allowed a consultant job or a junior consultant job. So basically post PG if you go to UK also, okay, then you will be able to do it within 4 to 5 years only, then you will become a consultant. Okay, so only in UK maybe there is a possibility that you guys can go post PG. Okay, so yeah, that many of my juniors, like post PG also he has gone. He's gone to different, and he's done a MCH route. Okay, in the meanwhile he passed MRCS, and now he's still doing his fellowships. Okay, so that way you can plan for UK after the PG also. Okay, one advantage of finishing in UK is that you can practice in European countries. Okay, so many of the European countries, they accept this MRCS, FRCS and MRCP for physicians. Okay, and for children also there are different, and MRCOG is there. So there are many avenues that are there. Okay, post PG I'm telling you. So you have to find a route and you can go.
So if you want to practice in India, it's better to complete your PG here itself.
Yeah, in India also, like so everything has become super specialty now. So without super specialty, it's little difficult to get a traction. Okay, with the patients especially. Okay, I mean not for the general practice. If you're satisfied, see that's also a part. Like if you are a doctor and if you are satisfied with what you are right now, post PG, you are done with it. Okay. So if you want to, yes, I want to do an orthoscopy, I want to do a orthoplasty, then it's a different scenario. Okay. So you have to do a FNB scopy or FNB plasty fellowships basically. So that wise. Okay. So depending upon your interest post PG, it's not forced upon, but it's not also a complete job. Okay. So but patient scenario is different. Okay. Patient scenario is like, if you are a patient, if you want to do a joint replacement, whom you will go to?
Who's the best in the business?
Yeah. Who's the best doctor maybe?
Yeah.
Okay. So maybe you will Google, maybe you will do a research with your kins and things. So who might have done number of fellowships, or who might have done more than 100, 200 joint replacement, definitely you will go to him. So, but not the MBBS MS guy, right? So probably you are overestimating or overshooting, but yes, this is what the scenario right now it is. Okay.
Okay, sir. Okay, so now that we have spoken about your internship journey and all the stuff, what we have to do and what we not had to do, and all the FMG stuff.
Yeah.
Now I'm really interested about you as a surgeon, sir.
Okay.
You completed your
Good.
orthopedics, and what are those fellowships that you have, sir?
Okay, so I completed my PG in 2019. Okay, so I applied for fellowships all over India. So I went to Punjab to do my joint replacement fellowship. Okay, and I did it for 1 year and Nagpal sir. Okay, in Nagpal Hospital in Punjab. Okay, and also I did it my Scopy fellowship. Okay, it was a short-term fellowship of about three months. Okay, so I have done that because I had a Scopy, I mean like exposure, I can say. Okay, during my PG days. Okay, so I was into that. So okay, and during my 1 year of joints, also I had here and there, like in a month, three cases of Scopy. So like I had into that. So 3 months was enough. So I did, and now I'm doing all the procedures. So yeah, that's how it's a fellowship.
I know
is.
one thing for sure, sir. You're very successful and you'll earn a lot, sir. That's for sure.
No.
I want to know the exact numbers, sir. How much do you earn?
Yeah, so the thing is, it's about the earning part also. Yeah, as a doctor, you have slogged for about 15 years.
Yeah.
So you definitely need to push your things. Yeah, so on average, I can say like around 2 lakh per month. Yeah, definitely will be your earnings of if you project it properly. Yeah, okay, so it can vary between a month of about 4 or a month without anything of maybe 1.5. So that will also be there. Okay, so if you project it on an average, it will be around 2. Okay, not beyond that maybe. Okay, see, it's for if you're working in a college setup, okay, without any private practice, it is same for everyone. It will be on and average, it will be around 1.5. Okay, 1.5 to 1.2 you can take. That is what the salary part of it. Okay, but coming to the private practice, okay, so I mean like private practice, it varies from cities to cities. Okay, from tier 3 cities. Okay, we are in tier 3. I mean Durga, Davangere and all are tier 3 cities. Tier 2 cities coming up to your Hubli, Dharwad, Belgaum or Mangalore. Okay, tier 1 is your Bangalore. Okay, so in tier 1 city, see, the thing is like your average salary will be around 1.5 once you pass out. Okay, 1.5. It's very difficult to get a job in a tier 1. Okay, competition is very excessive. But yes, yeah, once you get into the system in a private practice, you definitely, I'll not say from the day one in a corporate setup, okay, but yes, you're completely into a private practice. I will not join any corporate hospitals or anything. I will do it depends like how you are going to progress. There are my friends who have earned and nothing in a month. Even I have gone through that phase. Okay, there are months after my fellowship where I have sat in the home. Means to get a clarity on like where I should work. Okay, so it's not gonna be a day like from day one I'm gonna earn 1 lakh. That's the misnomer. Okay, there are people who are earning very less, but yeah, it's not gonna be everyone will be in the same boat. Okay, but you have to project yourself, okay, in a manner where depending upon your skills where you can work. Okay, so in a PG, in a post graduation, definitely you have to earn your skills, you have to earn your problem solving methods. Okay, so and patient care. Okay, competition in India is excessive, and in South India is literally on the brink neck, means cutthroat kind of thing. Okay, so why I'm saying is this, because like before, if you see, when I was a kid or a thing, like if I had a fracture, I had literally a fracture in Bijapur. I was doing a schooling there. In a city, hardly there are 2 or 3 orthopedician. Okay, right now in Durga, there are more than 25 to 30 orthopedicians. Okay,
Saturated.
I will not say saturated, but the amount of competition you have to do with the things, it's not competition. Basically, the who has skills will survive. Okay, ultimately it bottles down to that. Okay, yeah, so you have the skills, you will do good in your practice. Okay, basically that's a phenomenon. It's the same thing with any other field. You may be dermatologist, you may be a medicine, you might be any other thing. Basically your skills are the one which will get you things, and also the patient care. Okay, what you do, how you project it, and also now patients do not want that person who doesn't tell you anything. He wants that person who tell you everything about the patient. Okay, you have to tell him that like what happens if you do this, what is the end point of this. Okay, if you don't explain those things, definitely there'll be no patients who will come to you. Okay, so that wise I think you have to be on the top of your game. If you want to top of your game, you have to be earning your skills, do a good fellowships. Okay, work, slog under people who have done who have great skills. Okay, and work in a good setups which has a good number of patients, which is a chosen specialty of yours. Okay, so post PG these all things matters. Okay, PG also matters. Okay, doing in a good setup. Okay, and those things really important while choosing the PG also. Okay.
Okay, basically whatever you might do it with perfection. That's what you're trying to say, right?
Yeah, that's a perfection is one thing, and also the repeatability of the skills. You might do it in one time perfect. Okay, but you have to do 100 times perfect also. Okay. Yeah.
Okay, so that was about you as a orthopedic surgeon.
Yeah.
And so if you were to give us a glimpse about the corporate setup that's going all around, what is that? What are some things that you want us to know about the corporate setup?
So what do you know about corporate setup?
I know nothing, so I'm just a kid who just passed out from MBBS, and
yeah, okay.
What I know is that people say that doctors earn a lot, and I know that's not the truth.
Yeah.
Only this much I know.
Yeah. So the thing is like for a freshers, corporate jobs are very glittery, but it's not that glittery also. So you can work in a corporate setup after the MBBS also as a duty doctors and things. Okay, and also the post PG also you can join as a junior consultants or a senior registrars you're called. Okay, you will start your position. I'll tell you basically about post PG setup. Okay. So post PG setup you will be joining as a registrar. Okay, then you will be pushed towards the junior consultants, and from junior consultant to associate, then a consultant, or junior consultant to consultant. So this is how the progression goes. Okay, so how do you progress in a corporate setup? So in a corporate setup, always the ladder is depending upon how good your fellowships are, and how good your maybe DM you have done. Okay, or maybe number of countries where you have traveled to get your fellowships. Okay, those things matter. Okay, in a corporate job. Okay, so coming to the financial part, post PG, it's not that great. Okay, maybe you'll start with the very lowest salary of maybe around 70 to 1 lakh or maybe a 1.2 lakh. Okay, but not that much. Corporate job, they will take your work definitely. Okay, post PG also and post MBBS also. They whatever they have paid you, maybe they'll take a double X of work from you. That is definitely a thing. Okay, so that you should be ready for if you are entering the corporate job. Okay, sir, if that is the case, why they will enter, right? Okay, there are people who want to ascend only in a corporate thing. Okay, once you reach a consultant thing, okay, it's always that you will be getting a continuous good number of patients, because corporates will do a good amount of marketing for you and good number of skill upgradation for you, and those things will be running on your name. They will also be working for you. It's not that you will be only working for you. Okay, so they will also be working for you. They'll also be doing things for you. Okay, and they will pitch your name in the good amount of patients, good amount of geography wherever you're practicing. So those things will be happening. Okay, so and also it's a fine job. Like you go between 9 to 5, you're done. You will not work extra minute there. Okay, so for those people who want, I want 9 to 5 or maybe 5 to 12 or maybe night duty completely. Okay, perfection at point means, I mean, like you will be doing 12 to 6 means 12 to 6. That's it.
If I was to set up a clinic for myself, what are 3 things that I should keep in my mind before starting that?
I mean, like we are telling after PG.
After PG, yeah.
Okay, see, after PG there are 3 things. One is like you should know like how many years you're gonna stay in that place. Okay, one thing. And is it your local area? I mean, like whether you have been born and brought up from that place. Okay, and you have your good circle of friends or things like that. And third thing is like is the volume of population that you are serving, okay, will fetch me the patients. Okay, so before setting up these few things that you need to look into.
Okay, how much will advertise matter in this regard?
See, advertisement, first thing I'll tell about the clinic part. Okay, see, right now also when we practice in clinics, majority will not be from the advertisements. Okay, especially in tier 2 and tier 3 cities. Again, depending upon that, it will be always a word of mouth. Okay, you do a good to 1 patients, maybe he will bring 4 to 5 patients more to you. Okay, if you are losing, means if you are doing any, maybe you had one complication in 5 months, 6 months, you will be losing 6 to 7 patients. Okay, so people fall for negativity more. Okay, that's true, right? So thing is like doing a good part matters a lot. Okay, in clinic setup. Okay, that's the best thing. Yes, once you are in a place where you are getting a good number of patients per day, to increase that probably you need a push of an advertisements or putting it in a people area where they don't know you. Okay, that may fetch little bit of patients, but I will not say in tier 2, tier 3 cities it will give a big advantage, like okay, because of that advertisement people are coming, not much. Okay, but definitely your good work and good surgeries and good post-operative management, and definitely that will speak up.
Sir, and here we come at the last part of our podcast episode, sir.
Yeah.
And as I told you, we are going to talk about work-life balance in orthopedics. So how is it for you, and how's it for your friends and your colleagues, and how would it might progress?
Okay, so work-life balance depends on you exactly. I mean, like how you want it. Okay, so people may say that work-life balance is not there, this is not there, but it's all up to you, like how much you want it. Okay, yes, definitely you want to earn more, you have to lose your work-life balance. Okay, that is there. you might be underpaid and all those things. They people say yes, everyone are underpaid. Okay, it's not like somebody is underpaid or something. So those things you have to right now at this scenario. Okay, tomorrow many things may change, but right now the scenario is this. Okay, but yes, if I am satisfied with 1.2 to 1.5 lakh of a salary, okay, definitely I did not work more. I can do a 9 to 5 job. Okay, I can choose my patients. Okay, I can choose the surgeries when I want to do it. Okay, and you did not means lose your family ends. I mean, like I can go back to my family at after 5 o'clock, 6 o'clock. That's there. Okay, but yes, yeah. I mean, like you have to earn extra bucks. Definitely, you have to lose little bit on that. I won't say too much, but too much of losing. But yes, in the initial part of your career, surgeon's life is around 25 years.
Why is that?
Because 60, 65, you will not be able to much work. So you will be starting somewhere around 27, okay, 27, 30s. So by the time you will pick up your career, it will be 20, 35. So maybe around 25 years of your life, 25 to 30 years. So initial part, you need to just little bit slog more. Yeah, so yeah, it little bit deteriorates, but you can always choose your life. Okay, there are my senior surgeons who have never worked after 5 o'clock. Okay, and only emergencies, when they have emergency duties, they will do it. Okay, and that is a part of it. Okay, and weekly once emergency duties, that is okay, and they are happy. I mean, like they are happy with their life. Okay, so it all depends on you ultimately. Okay, yeah, that's it.
Okay, sir. So thank you so much for being on our show, sir.
Yeah.
For making your time and coming here and talking to us. It was a pleasure to have you in the show, sir.
Yeah, thank you for having me here. Okay, all the best for you guys too.
Thank you so much.
Okay, and choosing the toughest profession. Yeah, yeah, sure.
Thank you, sir.
Thank you. Thanks a lot. Thank you.
Meet again,
Yes,
sir.
yeah, we'll meet you again. Thank you.
ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ವಾಚಿಂಗ್. ಇದೇ ಥರ ಕೊನೆವರೆಗೂ ಸಪೋರ್ಟ್ ಮಾಡ್ತಾ ಇರ್ರಿ. ಸೈನಿಂಗ್ ಆಫ್ ಅರುಣ್ ಬಸವರಾಜ್.